Hey, I'm Amanda Brickhouse Murphy. I'm a certified nurse midwife at Mayheck OBGYN in Asheville, North Carolina, and I'm medical director of Mothering Asheville. I am so pleased to be representing our Robert Wood Johnson Clinical Scholars team, community-based doulas, lavish to essential support. My team members include Dolly Presley Bird, certified nurse midwife and PhD at Mayheck OBGYN, Dr. Crystal Sine of the University of California, San Diego, and Dr. Beth Bies of Mayheck OBGYN. Very important partner is Sisters Caring for Sisters, or SC4S, our community-based doula program, which I will talk a lot about in just a minute. Our team was influenced by our wicked problem, which was identified as the racial inequities we see in infant and maternal mortality rates. Specifically, that Black babies are more likely to die, 2 to 4 times more likely to die than white babies in their first year of life, no matter what socioeconomic status. We know racism is a root cause of this, and we know that these inequities are based in a healthcare system which is steeped with toxic stress, and that is predominantly encountered by women of color or people of color. Our team is strongly influenced by SC4S and their voice and what they need to be supported. I want to just take a minute to note that none of the SC4S doulas are on this Robert Wood Johnson Clinical Scholars team. Though we would have loved that, they had not quite yet met the 5-year requirement for experience in their career in order to be on the team. But we meet very regularly, and what our team does is use the resources provided by this Clinical Scholars Program, and both share them with our SC4S doulas and then also take them back into our own institutions in order to try to address some of these clinical and system shift goals that you can see here. There are our partners, and here are our specific aims. We hope to improve the reach of the SC4S program. That means getting more patients aware of what we are doing, how valuable our doula services are. We want to improve our referral process. We have a doula mentee program. We have people who are working on piloting doula reimbursement. We're one of the only clinics in North Carolina doing that for 3 of the Medicaid PHPs. Of course, we want to collect data, both quantitative and qualitative. We want to use that data to go and document the impact of SC4S by taking it to policymakers and trying to advocate for change. We want to increase the number of doulas at deliveries, and we want to integrate doulas into our healthcare team. Here's how we're going to do it. We're going to evaluate how well we're doing. That's how we're going to do it. Then we're going to evaluate. So we got to put surveys out there, just see what people are saying about how well we're doing integrating doulas into the healthcare team. Let's make an annual report. Let's make a scorecard that already exists and just keep adding to that, which is a web-based platform that anyone can view and that we can continue to use our expertise to input. Next steps. Let's get that policy change in place, Medicaid reimbursement for doula services. Let's continue to shift our organizations to be less toxic. And then we want to help support SC4S as they transition into their own independent nonprofit. Please, if you want to learn more, look there, look at the SC4S website and their Instagram page, and there's your Mayheck website as well. Thanks so much for listening.